there. Nice to meet you. I'm Nurse Mad. I'm going to go ahead and do your cranial nerve exam today. Can you please verify your first and last name and your date of birth? Perfect. So I do have you here in my system. Do you have any allergies? Any other allergies to other medicine? Okay. That's good to know. And when was your last checkup? About a year and a half ago, so it's been a while, which is good. Perfect timing. Do you have any concerns that you would like to address today? Okay. Yeah, I can definitely do a very detailed scalp check as well to make sure that there's no inflammation or any dry patches that could indicate reduced circulation. And have you noticed anything abnormal, like with your feet or your hands? Any swelling anywhere on your body? Okay. Any skin abnormalities, any dry patches except for your scalp? Okay. Any itchiness, fungal infections? No. Okay. And when was your last headache? Okay. So it was about a week and a half ago. And for how long did it last? 2 hours? And it went away with medication? Okay. And how many glasses of water per day do you usually consume? Okay, so about 6 to 7. Yes, definitely we want to aim for 8 to 9. But no worries, I'm going to do a test that will definitely give me a good understanding of how your hydration and nutrition is. Okay, do you have any questions for me before I begin? Perfect. All right, well then, let's go ahead and begin. On a scale of 0 to 10, how would you rate your pain right now? It's about a 4. Okay. And how would you describe it? Is it dull? Is it achy? Sharp? Okay. Good to know. And did you have any breakfast today? You did. Okay. I'm going to take your oxygenation. This is going to go on your index finger. Okay, perfect. Can you please take a deep breath in and breathe out? Okay. Oxygenation is 98th percentile on room air, and heart rate is 75 beats per minute. That's very normal. Okay, this is going to go on your forehead. Okay, 97.5 Fahrenheit. I'm going to take your blood pressure. I hope you're not anxious. No, that's good. Well, definitely we don't want to have a spike in blood pressure, so I think this is a good time to take it, because as we progress, sometimes people may rise up their blood pressure without any good reason. So let's go ahead and try this now. I will put it on your left arm. Is that okay? Okay. So go ahead and relax. Good. And I'll wrap this around your arm. And make sure it's tight. Okay. Okay. And we're just going to deflate it now. Okay, good. Blood pressure is within normal limits. I would say about 112/75. It's not too low, it's not too high, it's perfect. And for this exam, I'm going to have you close your eyes, but before you do that completely, I'm going to examine your eyes, okay? Obviously, I can't do that once you have your eyes closed, so let's go ahead and perform a pupil assessment, make sure that they dilate properly and they're equal in size, okay? I'm going to gently press my hand here on your cheek. Good. And now I'll have you look right here for me. Thank you. And I'll shine a bright light in your eyes. Good. So I'm not seeing any improper eye movement, which is good. And one more time. Okay, no rapid eye movement. Pupils are round and reactive to light. Keep on looking here. Good. And now let's go ahead and switch eyes. Go ahead and look right here for me. Thank you. Okay, no discoloration. Pupils are equal in size. Keep on looking here. Okay, that's good. So for the remainder of this examination, I'm gonna have you close your eyes, okay? And just make sure that you keep your eyes closed while we do all the exams. I'll let you know if you need to open them, but most likely you don't have to. So keep your eyes closed for now, okay? Is it okay if I put my stethoscope underneath your shirt? Thank you. Okay, just breathe normal for now. I'm only listening to your heart. I can hear only S1 and S2. Now is 3, now is 4. And I'm going to switch and listen with the bell now. I'm listening for any murmurs, which would indicate a valve abnormality. Okay, so no sounds there. And now I'll listen to your lungs. Can you take a deep breath in? And exhale. Good. And again, take a deep breath in. And exhale. Good. One more time. Take a deep breath in. And exhale. Okay, that's great. No abnormal sounds. I'm gonna have you keep your eyes closed, okay? And if you could flip your head and look up to the ceiling just for a little bit. I want to take a look inside your nose. Okay, let's check your other ear as well. Doesn't seem to be obstructed at all. No deviated septum, so that's good. Okay, I'm going to check your olfactory nerve, and I'm gonna have you take a deep breath in, okay, first. Now breathe out. Okay, and I'll bring this very close to your nose, and I need you to do the same thing. Take a deep breath in, and now breathe out. Good. And can you please first describe the smell? Use maybe 1 or 2 words, and then try to pinpoint exactly to what it smells like. It smells lemonish, okay? And you think it's a flower? That's good, yeah. All right. Let's go ahead and try one more. And we'll do the same thing. I'll first have you take a deep breath in and breathe out. Okay. And are you able to describe it first? So use 1 or 2 words at least. Okay. And what do you think it smells like? Okay, wonderful. Yes, it does smell like lavender. I have one more. Okay. So I'm gonna have you do the same thing. Take a deep breath in and out. Good. So what do you think this smells like? Again, use 1 or 2 words to describe it and then try to pinpoint it. It smells licorice. Interesting. And it's mint, yes. Okay, I do have one more. I'm gonna go ahead and just scratch it a little bit to make sure that there is the flavor coming out of it. Okay, and I'll approach this to your nose. I'll bring it very close. Now have you take a deep breath in again. And breathe out. It does smell like plants, okay? Earthy. That's good. Yes, unfortunately, yes, this is a mixture of medicine plants. but you are very close, and I'll take your answer as a positive answer. Okay, I do have one more here, and I'll have you make sure you keep your eyes closed. Do not peek. Can you please take a deep breath in again? And breathe out. And what does it smell like? It also smells earthy, like dirt. Okay. It is coffee, yes. Very good. Okay, have you noticed any abnormalities with your tongue? Okay, that's good. So I'll take a look inside your throat and your mouth. I'm gonna need you to open your mouth. I'll gently press down with this tongue depressor on your tongue. And give me a big ah. Good. Ah. Keep it out. Good. Okay. That looks good. Okay. Now can you please stick your tongue out and move it side to side for me? That's good. And up and down. Excellent. Can you push with your tongue inside your cheek? Good. Any pain as you're doing that? Okay, what about the other side? Any pain as you're doing that? That's good. Can you please give me a big smile? And now do as I do, frown. And puff your cheeks. I'm gonna need you to keep them puffed, okay? Don't let me unpuff them. Very good. Okay, can you please lift up your eyebrows? Lift them up, lift them up. I'm gonna try to push down on them. Don't let me do that, okay? Okay, there you go, good. And now I'm gonna try to push your head and your cheek that way, and I need you to resist, okay? Good, excellent. And we'll do the same thing on the other side. Good, wonderful. I'm going to check how your body perceives taste, and I will do the same thing. I will put some solution on your tongue. I need you to describe it in a few words, maybe, if you can. It could be sweet, it could be salty. Okay, so let's go ahead, and then I need you to definitely pinpoint to what exactly it tastes like. Oops. Good, good. So just 2 drops there. Okay, and what does that taste like? Sweet and honey. Okay, great. I'm gonna go ahead and put 1 drop of this, and I know exactly what it is. That's good. Again, I need you to describe the taste first and then try to. Okay, good. Okay, how would you describe this taste? Sour. And it tastes like strawberry yogurt. Excellent. Okay, and I do have one more taste. So go ahead and stick your tongue out for me. Good. And what does that taste like? Salty. Good. And it's pickles. Yeah. Okay. Excellent. I'm going to now check your scalp for any dryness, which really would indicate dehydration and maybe even poor blood circulation around the head area, and we can definitely perform some treatments in case we do notice anything abnormal with that. Okay, I'll have you keep your eyes closed. Okay, make sure that your eyes are closed so that you can fully relax, and I will perform a very detailed scalp check. Make sure that I'm checking for any signs of scaly patches. Okay, I am noticing a little bit of dryness and redness right here behind the ears. I'm going to go ahead and put some treatment right on the hairline here. Okay, go on, keep your eyes closed. And I'll massage this in. Okay, we'll do the same thing on the other side. And I'm going to go ahead and massage this in. Yeah, it's right here behind the ear. It's definitely going to help with hydration and to relieve any kind of pain. Okay, how does that feel? Excellent. And as you keep your eyes closed, good, good. I'm going to go ahead and do a facial sensation test. So that would mainly be nerve number 5, and I'm really trying to see how your body perceives the outside stimulus. I will go ahead and do 2 tests. One is going to be with a very soft brush, and it's going to feel something like this. Okay, good. And then it's going to be a painful stimulus as well, so it's going to be sharp and it's going to feel like this. Okay, did you feel both normal? Okay, What I'm going to do now is I will touch you on different parts of your body, including your face and maybe your arms and your chest as well. And I need you to identify if it's soft or if it's sharp. Okay? Just make sure that you keep your eyes closed. Good. And let's begin. Soft. Soft. Sharp. Sharp. Soft. Sharp. 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 Soft. Sharp. Soft. Soft. Sharp. Good. That was not soft, that was definitely sharp. Yes, that's sharp. Good. Okay, better. Soft. Excellent. As you keep your eyes closed. Good. I'm going to check your ears. Now, have you noticed anything abnormal? No signs of infection? Okay. I'm just going to take a look, take a peek, and make sure that everything looks very good. So for that, I'm going to have you look that way for me. Okay, good. And I'll check your other ear now. Go ahead and look that way for me, please. Margins are well defined. No vibrations. No signs of any redness. Okay, looks good. And I'm going to check your hearing with a tuning fork now. Have you noticed anything abnormal with your hearing? Okay, that's good. So what I'm going to do is I'll put it in two different positions. Position number 1 and position number 2. And I need you to tell me which position here is louder, 1 or 2. And I'll switch it up just to make sure that you did not learn a pattern. Okay? So that's position number 1. And this is position number 2. Number 2, okay. And make sure you keep your eyes closed. Good. And which position here is louder? Position number 1 or position number 2? Number 1. That's good. And again, which position here is louder? Position number 1 or position number 2? 2. Good. And let's do that again. Position number 1 or Definitely 2. Okay. Wonderful. Okay, I'm going to prescribe the same medication that we applied right here on your scalp, and I'm going to have you do that once a week. Okay, make sure that you do not wash your hair immediately after that. And otherwise, it was a very normal exam, and I'm going to have you keep your eyes closed, okay? And you can go ahead and open them up whenever you feel comfortable and rested. Okay? Thank you for allowing me to do this exam on you, and I'll see you back soon.